Thank you very much for giving up your lunchtime and for joining us for a symposium today to talk about the impact of type 2 inflammation on disease management, particularly in relation to nasal polyps. And this is a very exciting field at the moment. Now we have three fantastic speakers, so I will take up as little of our time as possible. And I'm delighted to be able to introduce Professors Klaus Bacher, Professor Tanya Laidlaw, and Professor Martin de Rosier, and they will be taking us through many aspects today. Now, just as a reminder, I'd ask you all to mute your phones. And most importantly, I'd ask you all to look in your booklets, and there are some question cards. And what we would like is for you to write down any questions that you come to as we go through the meeting. They will be brought up to me, and then I'll be able to ask some questions in our interactive panel session at the end. So you won't have to put your hand up. Even if you think the question is so basic and simple, please do write it down and send it up to me so that we can address that. Now, just as a disclaimer, this symposium has been sponsored by Sanofi Genzyme and Regeneron Pharmaceuticals, and we're very grateful. And the speakers will receive some compensation for their time and effort in preparing the lectures. There will be some discussion on treatments that haven't yet got FDA and regulatory approval for the treatment of chronic rhinosinusitis with nasal polyps. Now, these are my own disclosures. And so, as an agenda, as I said, I will take up as little time as possible, and then we'll move on to our speakers. Now, our plan really is to try and give you an idea of the burden of polyp disease, both in terms of the overall prevalence and the impact that that has on our patients and their quality of life, in particular thinking about their unmet needs. We're going to try and have a better understanding of the cytokines involved in type 2 inflammation, and really that growing understanding that this is a systemic disease and doesn't just affect the upper airways. We want to reinforce knowledge of current treatment options, including oral steroids and surgery, and better understand some of the risks associated with their use. And then we're finally going to look at the role that emerging biologics might play in the management of chronic rhinosinusitis with nasal polyps. So it's difficult to get an idea of the true prevalence of nasal polyps, and it's almost certainly underdiagnosed, but probably the best figures take us in the region of about 4% of the adult population. And it has a significant impact on their quality of life that's largely driven by the effect on their sense of smell. So if you look here, only around 10% of patients with polyps will have a normal sense of smell, and about 50% will have lost their sense of smell altogether. And sense of smell drives happiness. If you want to create a mouse model of depression, you cut the olfactory bulb, because that renders mice depressed. And that's pretty much the impact it has on our patients. Now, we know that particularly in the Caucasian population, the majority of polyps are associated with type 2 inflammation, and we'll be looking at that in more detail shortly. And we have a much better understanding of the pathophysiology. So this is a complex side, and every meeting a few more cytokines are added into the mix. But we have a much better understanding of the interaction between the microorganisms living on the epithelial surface and the innate immunity and the breakdown of that interaction, so this idea of dysbiosis. And there's a growing number of cytokines that we see in these pictures that are a number of targets for pharmacotherapy. And as I said before, we know that this doesn't just affect the nose. And Th2 inflammation is a systemic disease, so there's a lot of association with comorbid conditions such as asthma.